Thank you.
This is a question you will have 30 seconds to answer, and we'll begin with Mr. Sestak. But the question is, the Patient Protection and Affordable Care Act, Obamacare, is a great step toward providing health care for all Americans. So the question is, are you willing to take the next step and support the creation of a single-payer government health care system?
The major objective of single payer is to get rid of the insurance companies, and we embedded that in the Affordable Care Act. When the public option failed, we put in there co-ops. You take the one in New Hampshire. It actually has 80% of everybody who's come in there. No, insurance companies are forbidden to be in co-ops. Second, what we permitted is everybody in 2018 to go into those co-ops in the exchange, even from big business. And third, like's happening in a hospital here, the hospitals are no longer going via the insurance companies. They are actually going direct and trying to take patients. That's the practical way to get to the objective of single payer.
Thank you. Mr. Fetterman.
I'm a huge fan of the Affordable Care Act, and I've had a direct and personal family impact. Without the Affordable Care Act, my wife and I, who's in the audience, wouldn't have had health care. That's the only reason why we have health care today. And shortly after we bought our first policy, my wife suffered a pretty significant break in her ankle, and that saved us from financial disaster, and it got her the care that she needed. Affordable Care Act, we Democrats have to embrace it and bear hug it. Single payer is something that could be the ideal, but at the end of the day, I think it's going to be an evolution, not an overnight revolution. Thank you.
Thank you. Ms. McGinty.
Single payer, I believe, would squeeze a lot of the costs that we otherwise see in insurance company profits, et cetera, that are crippling the ability for us to achieve universal and affordable health care. Having said that, the Affordable Care Act is something that Democrats have to be proud of. Finally, we have a shot at universal health care. I was proud to work with Governor Wolf to expand Medicaid so that now 500,000 Pennsylvanians have Medicaid, $500 million a year we're saving. Here's the issue, Pat Toomey, hands off Medicaid, stop trying to repeal it, and Pat Toomey, hands off Planned Parenthood and stop trying to take our health care away.
Thank you.